Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for being with us today.
Well, thank you very much for having me on the program.
Okay, Minister, so I want to start with the AstraZeneca vaccine. I know last week you would have mentioned about 80,000 vaccines were being donated from the government of India. When we last spoke, you said protocols were still being discussed and worked out. Can you give us an update on that, as well as any other vaccines we may be expecting soon?
So we have a number of vaccines that we'll be receiving this week. Tomorrow we are expecting to get 20,000 vaccines from Sinopharm. And this is a donation from the government of China. So as I've said before, this Sinopharm vaccine, it's 79.4% efficacious. And this is going to be a very good vaccine to help us to immunize our frontline workers. In addition to that, we've had some experiences with the AstraZeneca vaccine because of the 3,000 doses that we got from Barbados. It's a similar vaccine that is coming as a donation from the government of India. So we are expecting about 80,000 doses on the 8th of March. So by the 8th of March, we should be able to receive those doses. And again, the AstraZeneca vaccine, we know how to use it because we have done that, and it's very efficacious if we are using a longer time interval. And so the scientific studies that were done has shown that if instead of doing the 4-week from the first dose to your booster dose, if you do that for 3 weeks, 12 weeks, then that would be more effective, to be at about 82%. So we have, our protocols are that we are going to do it for 3 months or 12 weeks. And so that's what we are using. We are also expecting confirmation from COVAX later in the AstraZeneca vaccines from them. And so we are waiting that confirmation from them.
Okay. Minister, with regards to the 80,000 vaccines from the government of India, and it being AstraZeneca vaccines, and I know we would have exhausted the 3,000 doses that we would have gotten from Barbados, will any amount of doses be put aside as a booster dose for the persons who have received theirs last month?
Yeah, so what we'll be doing now, we would make sure that we have enough booster dose so that when we administer the first dose, we'll save the second dose for those who need to get when they need the second dose. So we'll have that set aside so that everybody who got the first shot would be able to get the second dose.
And I know it was the protocol of the ministry to have the healthcare workers, the frontline workers, immunized first, and then we would have rolled out the vaccines to the wider public, starting with people with comorbidities. Can you give us an update on the process? How would the ministry be identifying high-risk persons?
So again, as you can imagine, 80,000 AstraZeneca, 20,000 Sinopharm, we have 100,000 vaccines. That is going to take us way beyond the amount of frontline healthcare workers. So we have now enough vaccines as of this week when they come in to be able to go beyond the healthcare workers. And so we have identified the persons who are older, and to help us to do that identification, we have been working with the Ministry of Social Services, where we're going to use the database for persons receiving their old age pension. So at least we'll have a sense of who those persons are, where they're living, and so forth. And we'll then be able to use that to reach those persons. The persons with comorbidity, as you would expect, a lot of people would come to our public health facilities. And because a lot of people are coming from to our services, we would have the list of patients at each of those clinics who are diabetics or hypertensive or have cardiovascular diseases or pulmonary diseases, renal diseases. We would be able to determine that. And therefore, health centers would help us to identify district hospitals, regional hospitals, and through that process, we'll be able to give these vaccines. We are working on some other strategies, bilateral strategies, to get in some more vaccines. So as we get them, we can expand the recipients of these vaccines. And of course, we are going to do this not just in Georgetown, but the 35 teams that we've trained are going to be in all the regions of Guyana. So we'll be able to do this simultaneously. And because we have been preparing our storage sites, we would also have storage capacity in every region where we can deploy these vaccines, and then our teams in there can pick them up and be able to distribute them.
Okay, Minister. Now, I know this would be, you said it would have been 100 and something vaccines from India and added to the one from China. And then we're expecting over 100 from COVAX. Where would this put us with all these vaccines? How soon can we expect herd immunity, if you can say?
Well, we'll still be a far away from herd immunity because with the allocation, say, of 200,000 doses, that would mean that only 100,000 persons we would be able to immunize. If we are going to get to herd immunity, we probably need to be about 70%, 80% of our population need to be immunized. So we still have a far way to go, judging that perhaps we have, 760,000 persons in Guyana, maybe more. Children, we can't use the vaccine on children because no trials were run on children, so we don't know how the vaccine would work in children. And even so, you probably might need to adjust dosage for children. So unless those trials are completed and we get a clear picture, we're not able to immunize children. So the adult population is the one that we'll have to work with and make sure that the majority of them take the vaccine.
Okay, Minister. Now, I know the Ministry of Health and the Indian High Commission, PAHO, WHO, and the United Nations would have signed an agreement last year to support the ministry's provision of intensive care medical equipment to improve COVID-19 patient care. Can you provide us with an update?
Yes, so that agreement, the government of India gave to us $1 million US, and that helped us to be able to procure ventilators. It helped us to buy PPEs like masks and so forth. And we were able to get those things in a very timely manner because we used the PAHO system, and they were able to reach out to a more global network and get those things in for us. Most of the equipment the ventilators that we're using at the infectious disease hospital is really ventilators that we bought through this grant. So we are extremely grateful to the government of India for providing these resources, and these resources have certainly made an impact on the patients that we have at the infectious disease hospital. As you know, we would have, from September to now, we have seen close to 700 patients at the infectious disease hospital. Not all of them would require ICU care, but a substantial portion of them did require ICU care. So when you come into the ICU, these ventilators are placed there. In addition to that, we had very little capacity of having ventilators at our regional hospitals. And so we have deployed from the set that we purchased with this grant to a number of regional hospitals. And so a lot of the regional hospitals now have that capacity. So if they have a patient that requires ventilation, then they can use this equipment.
Okay, Minister. Now, wrapping up, I know the GMRNSC would have held their first leg of drugs, but it was in breach of an agreement they had with the COVID-19 task force, and as such, the task force would have suspended all of their activities until further notice. Can we have a comment from you on that?
Well, a lot of time when the task force would agree to events, we normally would meet with the people who are hosting the event, and we explain to them what are the conditions that they must meet to host this event. once they agreed and they show us how they're going to put those measures in place, then we will allow them to go ahead with the event. If, however, we sign off and allow the event to go ahead and then there are breaches, then obviously we would not be able to continue working with that organization. I think that's the case that we have here now, because we do send out monitoring teams to all these events. We would send people to go and observe and see what is going on and report back to the task force. And in this case, we have had monitoring teams that were on the ground, observed what was happening, took photographs and videos and everything else, and the task force would then make that decision. So the decision now is to suspend them from having any activity until we can probably have a discussion and decide on the way forward.
Okay, thank you for that, Minister, and thank you for your time today. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.